Treatment differs somewhat based on age, gender, and type of trauma. So fundamentally, the approaches we take to single event trauma, which occurs among otherwise healthy adults who've had an accident or an assault or a recent severe exposure to a life-threatening disaster event or terrorism, and who were previously highly functioning before, that's usually time limited, usually emphasizes a practical short-term cognitive behavioral treatment which activates the memories of the trauma and helps the person process them, and where necessary we add medications such as anti-anxiety and antidepressant medications. For a specialized context such as combat trauma, which is more complex, more repeated, and often occurs in people who are vulnerable before they went to the war zone, we need longer-term treatments. It's usually involve a combination of longer-term behavioral therapy, psychotherapy, family therapy, and sometimes several medications. And where we needed other forms of biological treatments, such as newer treatments with transcranial magnetic stimulation, ketamine, new drugs we're testing like cannabidiol. So combat trauma, because it often occurs over a longer period of time and involves a combination of traumatic events, requires a more complex treatment. Also, if patients present with trauma following repeated childhood exposures to sexual abuse, physical abuse, emotional abuse, and emotional neglect, they often also have more complex problems and need longer-term treatment. Children, younger children, are often treated with a form of play therapy where they reconstruct and process the traumatic event through play. For example, we treated a lot of children after the earthquakes in San Francisco when I was a professor at the medical school in San Francisco, and you create a play situation for the children. You allow them, for example, to build their house and then knock their house down and talk about what it was like for them to be in a home that was damaged during an earthquake. So we use play as a vehicle to start a conversation with children who've been traumatized. Children also may benefit from medications that block high levels of adrenaline in their system and other more conventional therapies as well. There's some differences in treating adult men and women based simply on gender. We know that certain drugs are more effective for men and for women. For example, among the commonest FDA-approved drugs for PTSD, which are sertraline, Zoloft, and paroxetine Paxil, they're more effective in premenopausal women. And for postmenopausal women and men, drugs that have more complicated and less selective effects on serotonin work better. Drugs like Effexor and Pristiq and bupropion and others generally work better in postmenopausal women and in men.